Angela's going to be talking about what makes older people vulnerable to malnutrition and what we can do to help. I'll let you introduce yourself, Angela.
Yeah, is that
You just want to go onto slideshow.
yeah. Oh, sorry,
That's it.
I was
That's
pressing
lovely.
slideshow, but not hard enough.
Oh, we've caught you
sorry,
unawares, haven't we?
somebody's trying to call me now as well. Sorry. Oh, it always happens, doesn't it?
Oh, yes.
Sorry. Thank you for inviting me to this. It's been really interesting. I've been listening to all the presentations, so hopefully be able to make some linkages. So I'm a senior research fellow at the University of Hertfordshire in the Centre for Public Health and Community Care, or CRUPAC as we shorten it to. And you can see the title there. So I'm going to look at what makes older people vulnerable to malnutrition and what we can do to help. Okay, work out how to change slides. It's not. Oh, it is. Okay. So I'm going to draw on findings from a number of studies that we've been doing over recent years at the university, where we've been exploring food insecurity in later life. So they're a list of some of the ones that we've been doing. So I'm not going to dwell on that very much, but you can look at the slides later if you want, and you can always email me if you want more information. So just to talk a little bit about I know we've been talking about malnutrition, but so food security and malnutrition are very much interrelated. So I'm going to start by talking a little bit about food security first. So we know the UK food system is increasingly globalized. So we import food from other countries, and we know that occasionally there are scares and crises. The most recent, well, actually not the most recent one anymore, is it? But the big one most recently was around the pandemic, where lots of people went out panic buying, and it left lots of people really worried, especially older and disabled people, because they found when they got to the supermarkets, there were big queues, lots of empty shelves. And so it's important to understand how older people fit into the food system and use that. I'm not going to talk very much about older people's health conditions, because we've just had that covered really well by Richard. But when we started this work, the vulnerabilities, or indeed the strengths of older people in relation to food security were not well understood. So we use a definition of food security by Dowler and O'Connor, which is about the inability to consume an adequate quality or quantity of food. And the important bit is in socially acceptable ways, or the uncertainty that one will be able to do so. And we found that really useful to use. So in terms of measuring food security, it's only been measured since 2019, and that started being measured by the Family Resources Survey, and they found that food security increases with age. So the older you get, the more food secure you are, using their measures. And the Food and Use Survey, undertaken by the Food Standards Agency, is also measuring food security now. And it found that 92% of those aged over 75 were food secure. But just to point out, they use quite a narrow definition of food security, which is all about being able to afford food. But we can see, if you look at the right-hand table, where state pension sits, and how that relates to income and food security. So if you earn less than £200 a week, you're more likely to have high. You will be more likely to be food insecure, using their measures. So in terms of food security in later life, we know that older people experience factors in common with people of all ages. So people without enough money, and the price and availability of food affect everybody. But we know there are significant differences that do affect older people and their ability to respond to threats and food around food security. So older people quite often have smaller and shrinking social networks and experience social isolation and loneliness. We know that older people, as we age, we're more likely to have at least one long-term condition. We might have mobility issues or sensory loss. And all these make the process of accessing food very challenging. And we know the Malnutrition Task Force has reported on this quite a while ago now, for 2017. But more recently, we know that, and Neil spoke about this earlier, that lunch clubs and other groups that have traditionally provided food, social and wellbeing opportunities for older people, we know they closed during the pandemic. And there's emerging evidence that many have not reopened and may remain closed indefinitely. And Neil spoke quite a lot on that earlier. There's a lot of issues around funding of these kind of services. And with austerity and cost of living crisis, that's really affected things. So in terms of food insecurity, there are other measures besides the ones that surveys that I've spoken about. So Age UK estimated recently that 2 million older households have not got sufficient finances to cover essential spending, and 26% of those who took part in the survey said they were spending less on food shopping than before the pandemic. We know that older people are increasingly reliant on food aid and food banks. Unfortunately, we couldn't find any data when we looked at this from Trussell Trust. They don't provide a breakdown for older people, but IFAN, who represent independent food banks, noted that 90% of their food banks found that they were helping people who had not previously accessed support. And they found that Age UK is referring more elderly people for help than ever before. And older people are increasingly being seen in food banks. So before the pandemic, we found, that reports found that hunger and malnutrition was often hidden, often unreported, and Richard's presentation highlighted that really well. There are also generational effects, so older people often make do and don't like making a fuss. We know that weight loss can be seen as a normal part of aging, and our earlier presenters spoke about this. It's not inevitable, it's not part of aging. We knew that 11% of people aged 65 plus had difficulties getting to a local shop, and 12% struggle to access a supermarket. Also, 2 million people aged 65 plus live with sight loss, and that makes shopping more difficult. And our own work found that retailers could do more to support older shoppers, and I'll talk about this a little bit later, to support older shoppers to continue to access food. So emerging from the pandemic, as well as people struggling to prepare and cook food before lockdown, this has increased. We know that with lockdown, it also affected people's physical abilities. And Age UK reported that 1 in 10 were now finding it difficult to walk short distances outside, when this was not a problem for them before. I think we understand too little of the longer term impacts of the pandemic, and definitely need more research on that. Hospital discharge can be a time of vulnerability. We've heard a little bit about that earlier. I've talked about Age UK. We've also seen sharp increases in pensioner poverty, with almost 1 in 5 living in poverty. And a survey in January 23, again by Age UK, found that 9.6 million older people, were worried about how to heat their homes, as well as affording other essentials. And we also know that older people from Black and Asian communities are around twice as likely to be living in poverty as white pensioners. So quite worrying statistics there. So again, we don't have any really good robust figures around what the proportion of older people suffering from malnutrition in later life. It's estimated around 1 in 10. people, but we know that might have increased since the pandemic. Data from the US found that rates doubled during the pandemic. Public health messages are also problematic, and we've seen that talking to people working with older people, that often the people that are taking notice of things like the traffic light systems on food are the people that definitely shouldn't be. So people who are losing weight or are malnourished are avoiding foods with red traffic lights. So the one-size-fits-all messaging from public health is problematic. So the work that we've been doing is often underpinned by ethnographic approaches, where we spend a lot of time with households with older people. So we always start with them showing us around the kitchen, and then we do interviews. We film people in the kitchens. We videoed people going out shopping, people growing food on allotments or in the gardens. We took lots of photographs, and we observed meal times. And we also did food logs, got people to do food logs. So it's quite intense work, and we do this over 3 to 4 visits. So developing this work, we've put together what we call a food security framework, which is based on work by Schroeder, Butterfield and Marianti, but we've also incorporated some other theories into it. So this is the original model, which is 4 domains, and I'll just take you through each of the 4 domains. Hopefully it's not too complex. So the exposure bit is about the things that we all bring an experience. So the social determinants of health, and you hear people speaking about this quite a lot. So things like gender affects this, whether you've got your own house or you're renting, what your financial resources are, so whether you've got a private pension or whether you have state pension. The threats that people experience are the things I've just talked about. As you get older, you might have failing eyesight, declining mobility, experience bereavement or depression, hospitalisation, but also structural factors can be a threat. So cuts to services and public transport. Sorry, there's there's one of the threats there. So trying to get into packaging. Here's a quote from Chris, who talks about once his partner died, he could cook and he carried on cooking, but he found it a real struggle. He often looked at it on the plate and thought, I couldn't eat that. He just could not emotionally sit down and eat a meal. So the effects of bereavement are often not well understood. The coping capacity are the resources that we draw on to prevent us becoming vulnerable. So things like social networks are really important, having confidence and knowledge around food and where to shop. Our local environment, so where is the nearest shop? Can we get to it on public transport, or if we no longer drive? And things like services, so Meals on Wheels and lunch clubs also support people and add to that capacity to avoid vulnerability. And issues around inclusive design are also important. So here we've got a milkman delivering to one of our participants, and our participant was quite isolated and described the milkman as one of his best friends. And they had a really good relationship, really good social interaction as well. The Meals on Wheels services are also really important, as Neil pointed out earlier. It's not just about a meal. So one of the participants said he was losing weight. So the Meals on Wheels sent a nutritionist who weighed him and measured him and found he'd got malnutrition. And arranged for him to have additional things. So every day he got a soup plus a bun, free of charge, and he thought that was really, really great and really helpful for addressing his weight loss. Older people also contribute. So we've got Patrick here telling us he's a keen allotmenteer. He's always grown food and had an allotment, and describes himself as a mentor for the whole allotment. I've had enough experience over my lifetime that a lot of these things come naturally to me, and you pass on your knowledge to other people. And that's really important. Older people, not to forget that older people also make huge contributions. So we've added to the model this notion of cumulative trivia by some researchers led by Newell. And this is like small things that can accumulate to become a bigger threat. So issues such as lack of suitable toilets, parking near the shop, poor public transport, things like clutter in supermarket aisles, and that can also be where they're doing the shopping for people who have food delivered. So there's lots of trolleys and things around. Also things like lack of seating in shops, which is hugely problematic if somebody struggles with mobility and just wants to rest every so often. So here we've got one of our participants, he's got one of those walkers that you can sit on, and we saw him use that quite a lot, and other participants as well, just to have a rest. But we also found that this is not a one-way system. So, just because somebody moves towards vulnerability, it doesn't mean that can't be reversed, which is really really useful to think, that you can't, just because somebody has malnutrition or is losing weight, you can do something about it. And we've also drawn on the idea from elite sports, so the aggregation of marginal gains. So if you've got lots of things working against people through cumulative trivia, if you put lots of little things in, that can also support people. So that's the model. And just in summary, so how can we, the government talked about building back better, but how can we do that to prevent malnutrition in later life? So we're arguing that we have to see food as part of a wider social practice to understand how to keep older people healthy and nourished. So we found a range of factors, including but not just financial, work against older people with regard to acquiring food, remaining food secure and avoiding becoming malnourished. So this model helps to understand this complexity as people age, but also it shows us where we can make interventions. So we can reduce some of the threats, possibly. We can put little small things in often, so every little helps. We need to ensure income levels are enough to support healthy eating choices. Social networks are really crucial. And we found in our work from on Meals on Wheels that even the small and we call fleeting social encounters, so people delivering the food, because they went into the houses and were familiar with people, they developed more established relationships, and they also could do a check: is the heating working, all that kind of thing. So again, these things are much more than about just delivering food. We need to address structural factors that support food security. Things like public transport, which are often cut, are really important. We need to think about funding services, including Meals on Wheels and lunch and social clubs that help older people remain food secure. And although these are cut because of austerity, the work that Richard shows just shows, and the costs that he's produced show that, these kind of low cost upstream services could save a huge amount of money further downstream. We also would like to challenge supermarkets, and we've been trying to do that, to play more of a role in maintaining food security, health and well-being of older people by making supermarkets as accessible as possible. So we've produced a few things that could help that. So we produced a policy briefing for supermarkets to encourage them to provide things like really low cost things like more seating, better toilets, put in frequently purchase items near the front of the store so that people don't have to walk around the entire shop. More tailored promotions and discounts for older people who are spending less generally, and better training for managers and staff. So we produced with Focus Games a serious game which challenges people to think about what the issues are for older people, but also come up with solutions. And we made a short film as well, so all the links are on the slides, and just a few pictures of our participants shopping in various supermarkets. And that's it. That's all I've got to say, I think. So a bit of a whistle stop tour, so hopefully that's helpful.
Thank you. I think that's very helpful. But I think it was great, and I especially liked, looking at how the model to look at food insecurities. And I think one of the things that's coming out more and more, which we all know, is this business about lunch clubs. We've got to really do something about making commissioners understand that this is an integral part of keeping older people well. And
Absolutely.
It's not just an add-on for someone to go for the day. It's actually about their well-being. And we've really got to start working hard about that. And I think that that's something that the MTF are going to be looking at over the next year, along again with the public health messages, because you're so right. A lot of people get confused about what they should be eating. And I think especially when older people are cared for by their daughters, sons, and they've got their children, so they're listening to the public health messages quite rightly, but then they're bringing low-fat food round to their parents, and so we need to be working on that. And I think one of the good things this year is that we've had some engagement from supermarkets, which is the first year. So we're quite excited to see where that's going to go, because they do need to put more things in place for older people. So we're quite excited about that, and that'll be the second thing that we're going to follow up during this next year. So thank you, Angela. And if there's anybody who's got any questions, put it in the chat and I can forward it on to Angela. Thank you very much for your time. That was great.
Thanks.
Thank you.